We have a very special guest today, Dr. Dinesh Patel. He is orthopedic surgeon at Mass General Hospital for the last 40 years, and also he is a faculty member at Harvard Medical School. We are going to talk to him today about issues related with orthopedic knees, shoulder, and hip. Dr. Patel, welcome to our studio.
Thank you so much, Upendra. This is wonderful.
Sure, and thank you very much for your time.
Thank you.
So, for some of us who are really not very familiar with various issues related with orthopedic surgery, if you can briefly describe it, what are the issues which fall in this category?
Orthopedic main issues in orthopedics are bone and joint.
Mm-hmm.
And with bone and joint connected by muscles and tendons. So essentially when we call orthopedic, we call them musculoskeletal, muscles and bones.
Mm-hmm.
That's called orthopedics.
Mm-hmm. And so when it comes to that, we always hear that, especially in Indians, there's a lot of problem with knees.
Mm-hmm.
Sometimes there's a problem with the shoulders.
Mm-hmm.
And sometimes, in the older age, there's a problem with hips.
Mm-hmm.
So, what are some of the issues? Let's go start with knees.
Okay.
And so, what are some of the issues you face, and how do you fix them, and what are the symptoms?
Well, usually I think we all like to walk. So when you walk, the pressure goes in the knee. I think most of us, one or the other way, like say for example, Muslims go to Namaz, they go on the knees. Christians go to church, they go on the knees. Hindus and Buddhists and Jains and Sikhs, Parsis, they all go to pray on the knees. So think about it, what happens. If you are on your knees all the time, there has to be increasing pressure. If there is increasing pressure on the knees and you begin to get up, there has to be some twisting motion. And if motion has got some twisting, something hurts. So the most common problem we see in, I wouldn't say elderly patients, but patients above the age of 50. We all tend to go to church, we all tend to go to mosque or temple or whatever, and then something happens. Or you go take a dinner, or you do puja. All of this involves increasing pressure in the knees and begin to get up, something happens to you. So that problem comes to them. If you look at children's or sports people, their problems are little different. The high performance people, they run. When they run, there is a constant friction. They play basketball or twist. So there's sudden change in direction of the motion.
So, Dr. Patel, what are some of the symptoms we should really watch out for in knees or shoulders or in hip, that when that starts happening to us, this is the time to see a physician?
Well, most commonly the patient will come with pain. They have pain when they're walking, they have pain when they're doing stairs, they have pain when they're playing tennis or golf, or pain when they go to puja. And then the second thing happens is swelling. If the knees swell, then they have pain. And then when they're swelling, the knee becomes stiffer. When they get stiffer, they have problems walking. They have problem of doing stairs. The problem picking up their granddaughter or baby. The problem getting gardening. So all of these starts with pain, swelling, difficulty in walking, difficulty in moving.
So see, from the beginning of first symptoms till times comes to that, I should say, doctor, roughly what is the time frame, how much time it might take?
Well, it depends on patient to patient for sure. But if you got an acute pain from skiing, for example, that's totally different than pain coming slowly walking on a Charles River. So if there is acute pain from a fall, from skiing or golf and swelling, you got to see doctor more or less earlier.
Sure.
Yeah, because of the extent of the problem.
Sure.
So if you got a pain in the knee swell, that means that something is not quite right.
Sure.
Just like tears in your eyes.
Sure.
If you got tears in your eyes, that means something is floating. You got to see someone to find out why your tears and try to help yourself.
Okay. So now say I have some issues in my knees and then I come to see you. So I know you have brought something to show it to us.
Right.
And if you can explain how the knee functions.
Okay. Let me show you. The knee, this is the thigh bone we call upper leg. This is the bottom leg. This is called leg. So between the thigh and the leg bone, there are two cushions. One cushion inside, one cushion outside. One can say the meniscus or cushion or cartilage, either of them. There are 4 ligaments in the knee. If you look at it here, one is outside, one is inside, and 2 inside. They call a cruciate ligament. So let's see, and then on top of that we have what we call a kneecap. This is a kneecap. So kneecap moves like this when you go up and down stairs. When you sit for puja, see what happens? Lots of pressure in the back of the knee, or yoga. When you're playing tennis or golf, you pivot it. See what I mean? So what happens, there is a pressure between the femur or thigh bone and the leg bone, and that pressure is taken away by 2 cushions. So if the pressure is abnormal, like driving the car, for example, driving too fast or in a haphazard manner, something will wear and tear. So this will become wear and tear, and where it's wear and tear, particles float in the knee, and the knee swells and it hurts. Let's suppose you went for skiing or a soccer game or football. The person will hit you, boom. See what happens? The ligament gets torn.
Yeah.
The bone pinches here. So the torn ligament and a fracture. So you got a pain, swelling, and you just can't walk. So this is normally the knees. In young girls, they are hypermobile. That means the kneecap is more moving. So here is the kneecap. See, the kneecap should move like this. So for a ballet dancer or a garba or bhangra or whatever, where there is certain twist, hold it here, Upendra, up on the top. So this is the kneecap, okay? When I'm doing garba, see what happens?
Yeah.
The kneecap shifts.
Right.
So when the kneecap shifts, and if you do too acutely, you may crack the bone here or do this. So all of these things is important when you talk to patients. How did you injure it? Did you injure it by twisting? Did you injure it by squatting? Did you injure it by stairs? They get pretty good ideas by doing it. So that's in short a normal knee. They have motions, bending motion, up and down motion, they have twisting motion, and they have sliding motion. So it's a very complex joint.
So these issues can be fixed, right? Through
Right.
surgery and all.
Right.
And what about the old age? How the old age makes
So what happens in old age, this is you must have seen our grandmother or grandfather or something. If you have them stand, you must have seen them walking like bow-legged.
Okay.
They walk like this. They're nice, good, stoicy mother, father, grandpa. They don't complain, but they walk like this. So see what happens? You grind out inner side of the knee, just like the tire. The car tire or the shoe. If you walk on the outside, you're going to wear the shoe away. So over a period of years, our mom and dad and grandpa and grandma, they do that kind of stuff. So what happens, the cartilage here and cartilage here is worn away.
Mhm.
This is similar to the shoe.
Mhm.
Outside of the shoe gets worn away. So when it worns away, then you get a bone exposed.
Mhm.
When the bone gets exposed, you get pain. Cartilage doesn't have pain fibers.
Mhm.
Follow me? So the pain comes after you wear away. And when the knee wears away, there is a bone-to-bone contact. You can't bend the knee. You cannot sit like Palati. You cannot do puja because it hurts.
Mhm.
You cannot do stairs because it hurts.
Mhm.
So you walk.
And does that cause more damage or
Well, you already have a damage.
damage? Okay.
And then if you, say for example, if you have a shoe, if you're nailing a shoe,
Hmm.
what's going to happen?
Sure.
You're going to pretty soon hole in the foot.
Sure, sure,
Right?
sure.
So if you keep walking, as some stroke people will walk on it, then you get more hole.
Sure.
So once the cartilage is worn away completely,
Mhm.
then you get more pain. You can't bend, you can't extend.
So now, how we can avoid this type of damage to our knees? What are the things like, say, what are the 3 or 4 things we should do?
Well, the most important thing is you must have seen the baseball pitcher. Give me an example, okay?
Sure.
If you are a baseball pitcher, does he pitch every day?
No.
No, why not?
Because he's not playing every day.
You need to rest his muscles and joints and endurance. So same thing here. If you decide tomorrow that I want to run Boston Marathon tomorrow, the body would not accommodate all the stresses.
Mhm.
For example, in the Korean War, there are many stress fracturing soldiers.
Mhm.
Why? They just keep walking, keep walking. Muscles got fatigued, bone took the stress, they got fractures.
So basically, you are saying that the rest is important.
No, the most important thing is anything you want to do, you do in slow, gradual increment.
Okay.
For example, if you want to run, don't run 5 miles today. Run a little bit, run a little bit more, run a bit more. That's one part of it. But in order to prevent more injuries,
Mhm.
you want to make sure your muscles are stronger.
Sure.
You make sure that you are quite flexible.
Mhm.
For example, if your muscles are quite tight, and if you take a long stride, you go to hamstring pull, buttock
Sure.
pull, calf pull. So you would know yourself. So what we call answering a question,
Sure.
how to prevent it. You prevent it by you knowing your body well,
Mhm.
but specifically make sure you're flexible, make sure your muscles are stronger, make sure whatever activity you do in slow, gradual increment.
So like earlier you were talking about, I give the examples of, Garba and Puja
Right,
and yoga
right,
and meditation
right,
and all
right,
this stuff.
right.
So those things would also be done in moderation or gradually, should not.
Well, I think each individual is different. Let's say, for example, 20-year-old athlete, for example, is quite fit, and he goes to Garba or Bhangra, he's less likely to have troubles because he's already fit.
Sure.
But if a person like me suddenly decide that I love Garba or Bhangra, I'm going to get hurt. So each person has their own capability of stresses and strain.
Sure.
Yeah. So you to answer your question again, that if you really want to do Garbas, you don't do right away 15 circles because
Right.
you get fatigued out. Yeah.
Sure. So now let's move to shoulders.
Okay.
And tell us what are some of the issues in shoulders and what are symptoms in shoulders.
Well, if you shoulder is a very another interesting joint. So if you are a cricket player, for example, you see the motion goes in shoulder. If motion goes this way, and that way. If you are a golf player, motion goes this way.
Sure.
Right? If you're carrying a little baby on your head, motion goes that way. Do you follow me?
Sure.
So anything abnormal, any place in the joint and the shoulder. Say, let's say, for example, you're playing tennis, and you do like this, more than what the shoulder can accommodate, you're going to either sublux the shoulder or dislocate the shoulder. So the common problems in the shoulder or the joint are essentially same. Don't overdo it. Make sure you know your body well, and make sure you're preconditioned to the sports you want to do.
And so you have brought something to show us about shoulder as well. Very exciting, yes.
Well, shoulder is also a complex joint, okay? This is called collarbone. Let's see, this is mine, okay? Looking from behind. This is the collarbone. This is, we call a scapula, but it's a shoulder bone. So it sits on the shoulder like that, okay? And then this is the upper arm. So look at these. When you are pitching, boom. You see what I mean? What happens?
It stretches.
It pinches.
Yeah, sure.
It pinches. So that is the most common problem in all of us, is we call it impingement syndrome. So when you begin to pick up a telephone, you hurt me, because you're impinging. You try to comb your hair, it pinches. Impingement syndrome. So if it pinches, it hurts. If it hurts and you don't move, it gets frozen, you can't move, it hurts you more. So that's one most common problems, impingement syndrome we call it. The other problem we get, this more in the younger people, where the extremes of motion, okay, can dislocate the shoulder. Shoulder pops out. They call it, my shoulder is popping out, because hypermobile joint, shoulder pops out. And the third common thing could be the, you may of course get a fracture or arthritis. Arthritis is less common in shoulder. The reason, because it's not a weight-bearing joint. You don't walk on the shoulder.
Okay, sure.
You know what I mean?
Sure.
Unlike the knees. Knee walk, so your arthritis is more common. Shoulder is not, it's a functional problem. Combing the hair, it hurts you. Brushing the teeth hurts you. Picking the telephone hurts you. So that's because you injured something in the shoulder.
And now come back to hips.
Okay.
So also the hips are a big issue, especially in the older age, especially. So what are the precautions we should take for hips?
Well, hips are much more important from childhood. Okay, so what happens when the baby is born, you want to make sure that the hips are supple. So pediatrician will look at it. So when you look at the baby when they're born, you make sure you look at it so it's not abnormal leg lengths. If you catch them earlier, you take care of it. So if in babies you see their hips clicking or not right, then you prevent it. This is the best thing ever can happen in orthopedic surgery. If you catch this early in a baby, we call subluxing hip. So if you put on a diaper or something, so hip remains wider. So it remains in a socket, and you really make their life very comfortable, easy. They're all cured. So I think in the hips we have to look at right from the birth of the baby till they are older. So that's one problem. Other problem happens in the hip is the same thing. Little babies don't complain, pain, but they don't move the hip. See what I mean? So we have to be careful. If baby doesn't move that hip, something is not right. Let's make sure we see a pediatrician or a surgeon, take care of it. The other thing in the hip happens in babies 3 to 6 years old. Suddenly can move the hip. Mother worries, father worries, uncle and aunt worries. So they have the condition called swelling in the hip. We don't know why. So if you take care of them early by rest or management, you're cured. Then the third hip comes in from age 14 to 18. Our growth comes at certain place called a ball, and the growth place takes place just below the ball. So we just about to stop growing by 14 to 18. That's about the same time the kids are a little stronger, they're hefty, they want to play sports, and the growth plate is maybe a little weaker. So suddenly growth plate falls. So for those patients, you got to be very careful. That complaints about hip or groin pain, then for them is a totally different condition.
Now, Dr. Patel,
And coming further,
Okay.
aging-wise, the if you go skiing or something, or a car accident, okay, very common. If you got a car accident, you're sitting like this, dashboard is here, boom, hip dislocates. You got a major fracture in that age group. And then as we grow, you got a arthritis in the hips. You can walk, a limp, is a cane.
So then we'll go to my next question, like arthritis. So what are some of the symptoms of arthritis? And what are some of the treatment?
Symptoms are essentially same.
Same,
The
okay.
patient comes in because I can't walk.
Okay.
I cannot squat. I have pain. I cannot walk too long. The clue for that, whether it's a hip or back, the patient who come in to see us for hip, it may be back, maybe knee. So hip pain is always in the groin.
Okay.
If someone comes and says, gee, doc, hurts you here, here or here outside is usually back. You know, but if it hurts you in the groin, it's hip joint. So when someone patient comes in with quote unquote hip pain, you got to make sure it's not from the back.
Okay.
Someone complains of the back pain, you got to make sure it's not the hip. They are intertwined, and so they come with the pain. They cannot sleep well. They have to sleep on the side. They put a pillow under their knees because they are stiffer.
Sure. Now you have been doing surgeries for all these things for the last 40 years.
Right.
How scary it is, or how safe the surgery is? Is it better to suffer through a little bit more pain and avoid surgery, or is it okay to?
Well, I think the advancement in anesthesia is remarkable at the present. I think we used to worry a lot about the general anesthesia, but I think that worry is very little. Okay, so if someone is worried about that part, then I don't think we should worry whenever we have surgery, of course, but we shouldn't worry as much.
Okay.
The second thing happens that the diagnostic and monitoring system at the time of surgery is so good that you can catch things early and rectify.
Okay.
Third thing is the medical doctors, internists, they know how to manage it well ahead of surgery and after the surgery. So that's taken care of. So from that perspective, the complication rate is dramatically reduced, including infections,
Sure.
blood clot, whatever.
Sure.
Now the question you may ask, which you asked, is should they do surgery or should they not do surgery?
Exactly.
So what answer should I give it to? Tell me, what should I tell them?
Well, you tell us. I have no idea. That's why I'm asking you this
So
question.
I tell patients, okay, listen, what is critical in your life is your quality of life, right? Your quality of life, you want to play with your grandkids, you want to enjoy yourself, you want to go to Haridwar, or you want to go whatever. That's your quality of life. If quality of life is compromised to the extent that you are watching TV all day, or your children are constantly worried about it, and you worried that they are worried, and medically you're pretty healthy, tackle the problem. Tackle the problem. Take care of it.
Any age, like what age should be?
There is no age.
There is no age. Now.
Age-wise, if you're a 36-year-old person and you've got a cardiac problem, you're just as good as a 90-year-old
Sure.
who has no cardiac problem.
Sure. Okay.
But mind you now, with good medical care from internists, there are very good internists, there are cardiologists, there are nephrologists, there are diabetologists. They evaluate the patient before they can tell surgeon they're ready to go. Do you follow me?
Yeah.
So I think critical part is the quality of life. Patient is 80-year-old, for example, and we know he's quite healthy. So are you going to let him sit in a chair for the next 20 years? No.
Sure.
Let him enjoy his quality of life, similar to what we will call the palliative care. You give morphine for pain, you go to pain. Well, this sort of palliative but curative, so that he will be able to enjoy his life, he will be able to see movies, You'll be enjoyed to see your ghazals, read your newspaper,
Sure, sure.
read your videos,
Sure.
and all this stuff. Yeah.
So, Dr. Patel, another question for you is there any particular exercise you recommend which is good for the knee or shoulder?
Well, when you walk,
Mhm.
for example, when you walk, every muscle comes into play.
Mm-hmm.
When you walk, you put weight on the foot, ankle, calf, knee, hip, and the back.
Mm-hmm.
Do you follow me?
Sure.
So every muscle has to be tuned up.
Mm-hmm.
But for the knee specifically, when you get knee pain, thigh muscles, front and back, calf muscles, hip muscles get weaker.
Mm.
So you need to strengthen those muscles. Yeah.
Okay. What about anything with the diet? Any diet is good for bones and.
I think in the modern arena,
Mm-hmm.
the people are eating good food.
Mm-hmm.
So I don't think that has any major issue.
Okay. Anything you have noticed is specific to Indian or South Asian community when it comes to these orthopedic issues?
Well, the major issue Indians have it is Indians is the knee issues.
Mm-hmm.
Because they all want to pray God.
Mm-hmm.
They eating Pilates,
Mhm.
they go to namaz,
Mhm.
they go to church,
Mhm.
they pray. So issues on the knee is quite significant. I'll tell you a very interesting story.
Sure.
This is about way back, about 15 years ago, the president of Egypt invited me to look after the
Mubarak, President Mubarak. Mhm.
Abdul Haq, Grand Marshal.
Mm-hmm.
So we went to Egypt, taught all the doctors, and then he was a knee problem, so we fixed up his knee. And then next morning I went to see him, and I joked to him, I said, "You really are a great priest,
Mm-hmm.
wonderful man." He says, "Why?" I said, "Because you got so much knee problem.
Yeah.
That means you've been praying almost every day."
Okay. Yeah.
And we're just joking out of
Sure,
it.
sure.
So what tells you that if you are squatting,
Mm-hmm.
or in India, for example, in India we squat,
Sure.
right?
Mhm.
So the most common problems are
Mm-hmm.
at the knees.
Mm.
The other corollary I give it to you, Eskimo, for example.
Mhm.
Okay,
Mhm.
Eskimo keeps their children's buttoned up.
But yeah,
See what I
sure.
mean?
Yeah.
So they are like this.
Mhm.
So they have significant problem in the hip
Mm-hmm.
because hips are there. We have our children's sitting like here.
Mm.
So our children don't have hip problem.
Sure. Now, since you mentioned President Mubarak, what are some of the other celebrities you have treated about whom you can talk?
Well, here are taking care of Ted Williams.
Ted Williams, like the big.
Big Ted Williams.
Okay. Like we have a Ted Williams channel.
Same Ted Williams.
Okay,
Yeah.
good, excellent.
And if you are coming to India,
Hmm.
the famous cricketer Kapil Dev.
Kapil Dev, oh, sure, yeah. So he just who retired a few years ago.
Well, a very interesting story. He had his surgery in London,
Mhm.
and he didn't do as well.
Mhm.
So someone told him, "Why don't you see your countryman?"
Mhm.
So he came to see me. This is before the World Series.
Okay. Which year roughly it had been?
84.
84, okay.
84, 82, whatever.
Mhm.
So I fixed up his knee. I told Kapil, I said, "Listen now, you got to listen to me. Then and then you're going to get better."
Mhm.
So he listened to me, and whatever, they came back again, and he won World Series.
Well, you must have, now I know that the real secret that you must have made a big impact on, India being such a ahead, through Kapil Dev, so.
Well, no, we started this arthroscopic surgery, not just in India, and I have a big talk, high-tech transfer in emerging countries. We talked in Egypt, in Brazil, in Mexico, all over the world.
You also involved with some charities and some.
So we
things
have
to do.
established Asia's largest psychomotor skill laboratories.
Mhm.
You know what that is? Formerly what used to happen, that the doctors will come from India to spend time with me, 2 months, 3 months, or 6 months, or whatever. And we had started a project with Rajiv Gandhi, our 3 fellows come.
Mhm.
But then I thought that if he goes back,
Mhm.
he's the only person who knows it.
Sure,
So why don't you do reverse transfer?
sure.
So then I started, I am a German, Italian, American friend come with me, and we will run a camp in India.
So when did we start that?
80.
1980.
1980. Rajiv Gandhi started.
Okay.
I remember Rajiv Gandhi because he heard me. he called me from Delhi. So the conversation went in by like this, sidetrack, but just
Sure, no, absolutely.
it.
Sure, absolutely.
So I said, Rajiv, now you bringing 20th century to India by a computer something.
Sure.
But I want to tell you, I brought 21st century in my small town. So what we did,
Sure.
we will, all these guys who come with me, we'll have 2 sets of cameras. My parents and whatnot, they will clean up the hospital very clean. We'll run a camp. So I had to say that we have thousands of patients we saw. And then we did 2 operating room, this and this, the Egyptian and me, we kept, no, just me, I won't let anyone into it. So we did surgery, and it was live televised, the patient's relative will see outside.
Did you?
That was a long time ago.
So, do you still do that in India or not?
Yeah, no, that has become a standard of care now.
Okay.
India is so I feel proud of the fact that we have taught people high tech, which is high tech, but helps patient get better faster.
Dr. Patel, thank you very much for coming to our studio, and we are really looking forward to hearing your presentation and moderation, and Dr. Jaipal will be there too at the upcoming Health Expo in Burlington on April 19th.
Well, let me just end by saying that I think you and Manju has sort of revolutionized.
Thank you so much.
Revolutionized, not revolution, but revolutionized in terms of serving the community at large by having the Med Expos, the wedding expos, or chai, or masala chai, garam chai, whatever you say, that has stimulated the community to do something special.
Sure.
And apart from helping them, you also have stimulated them. Why cannot be like
Sure.
Upendra?
Yes, but thank you very much. You have been a very big supporter of Indian News, and we have always counted on your support, and continue to support us everything we do. So, thank you very much.
Okay, thanks so much.
Thanks again.
We wish you the best.